Welcome to the Obesity Medicine Podcast with your host, Dr. Matea Rentia, board certified in internal medicine and obesity medicine. Here, we talk about a path to metabolic health, and we have real conversations about chronic weight management and living a full life. Just a reminder, I am a physician, but I'm not your physician. So everything that's on this podcast is for informational purposes, but please go talk to your doctor about what's right for you. There is no medical advice being given on this podcast. Welcome back to another episode of the podcast. We're going to talk about something today that has become increasingly something that everyone's asking me about. What I see as a clinician right now is that as more and more people are able to experience sustainable weight loss, a new set of questions has come up around excess skin and what to do about it. And while it's a really personal decision, this isn't right for everyone, but many of my patients, this isn't just about appearance. This is not a cosmetic thing. It's really about managing skin infections, improving mobility, and really feeling more confident in their bodies that they've worked so hard to come into. In this episode, we're breaking down when to get a consult, how to think about surgery in a different informed way. And so hopefully after today, you can know how to go forward a little bit more easily. Dr. Beckman, thank you so much for coming on. Can we start with you just introducing yourself a little bit about you and your clinic? And then can you tell us a little bit about why you got into plastic surgery? Because I'm always so curious.
Thank you so much for having me on your podcast. This is something that is very different. I haven't done anything like this before, so hopefully it goes smoothly. My name is Dee Beckman. I am a plastic surgeon in Carmel, Indiana. My specialty is aesthetic procedures of the face, breast, and body. I did do extra training in an aesthetic fellowship that emphasized body contouring. Those procedures are definitely very near and dear to my heart. The body contouring procedures in post-weight loss patients. The patients work so hard to lose their weight, and I'm just grateful to be a part, often in the final steps of their journey.
Yeah. Do you know what occurs to me here as you're talking? That I don't think that the regular lay person understands how much training goes into this. So when you mentioned how you did additional training with body contouring, I think because there's a lot of surgeons that just say they do the procedures, right? Like am I wrong with this? Like they come from general surgery and they can just do that. Versus when you actually have the training that you have, I think it's very different. Am I wrong with that conclusion?
No, you're correct. So for these procedures, you really are looking for a plastic surgeon, a board certified or board eligible plastic surgeon. That can look like general surgery training, or now you can do an abbreviated training of just direct plastics in an integrated plastic surgery residency.
Okay.
But what you're looking for is a plastic surgeon, not a cosmetic surgeon.
That's what I was referring to. So thank you, because I feel like the language, even I get it confused. So everybody that's listening, please write that down because this is very important because there's nothing more devastating than someone operating on you. You didn't really vet them. You don't know their credentials. This is something that you really need to care about. When is the time when someone, let's assume that they've lost a lot of weight, assuming that they want skin removal surgery, when should they actually seek out the consult?
So that depends. I love to chat with patients. So I'm really happy to chat with them wherever they are on their journey. You really do want to be close to your ideal weight before undergoing the surgery. I like to see at least 6 months of weight stability, and that's for two reasons. So first reason is just longer lasting results. If you get the surgery and then you lose a ton more weight after that, you might notice some of that extra skin recurring.
Yeah.
And the second reason is just safety. If you're not weight stable, especially if you're losing a lot of weight, maybe in an unsafe way, your nutrition may not be as optimized.
Yeah.
So in those cases, it makes for a safer surgery if you are weight stable for at least 6 months. But I'm happy to have that conversation whenever. I love to educate. I don't have a strict BMI cutoff.
Okay.
Usually if your BMI is over 35, I start looking at other factors, comorbidities. So sleep apnea, heart disease, lung disease, diabetes, all of these things can make for a more surgical risk.
Okay.
So certainly if you're a higher BMI, you do need to take those things into consideration. But I don't have a strict cutoff. I'm just here to have conversation with the patient and discuss their goals.
I love that. Perfect. What are the most common procedures that you're performing right now?
For post-weight loss patients?
Yes, for post-weight loss, yeah.
Yeah, there are a few tummy tucks, body lifts, arm lifts, thigh lifts, breast procedures like breast lifts and reductions. I would say those are the most common.
Okay. And
Mhm.
how do you decide? Do you do multiple at one time? Do you stage it out? How does that decision get made?
Oh, that's a great question. It's very individualized. Oftentimes, a patient will come in and they have an idea of what area bothers them the most, and I'm certainly happy to oblige. If they have extra skin everywhere, I usually start with maybe emphasizing the trunk in a tummy tuck or a body lift to just reset their frame, and then
Yeah.
staging procedures after that, whether it's with breast or arms and legs. Most certainly, everybody is usually staged because these procedures are quite long. And you don't want the longer you get with certain procedures, you just don't want to keep adding time.
Yeah, definitely. Can you explain the difference between, for people to understand, what is a tummy tuck? What is a body lift? What does that actually entail?
Oh, yes, I get asked this quite a bit. Tummy tuck traditionally is a standard abdominoplasty. That usually is an incision hip to hip, and that's addressing the loose skin in the front in just your abdomen. And that can have a muscle repair with that as well. Now, a body lift or a lower body lift, typically, that is an extension of the tummy tuck of the standard incision. So now your incision is circumferential, and that not only addresses the front, but now you can address extra skin on the sides, extending to the flanks and lower back. Yeah, so you'll
Got
hear a few terms: 360, circumferential. Sometimes it's very different between what surgeons are calling it too. So it is important to clarify those incisions.
Yeah,
Yeah.
because I feel also like I'm hearing like fleur de lis, which that's what is that circumferential around, and what else is happening there when you're
Oh,
doing
fleur
that
de
term?
lis.
Yeah.
So, yeah, so that's a great question too. Fleur de lis is the vertical component that you can add to a tummy tuck, often circumferential. So,
Yeah.
if there is somebody with a lot of extra skin to be removed, they may need the circumferential incision to handle all of the excess tissue in the vertical direction.
Yeah.
And then that vertical component of the incision in the front handles extra tissue in the horizontal direction.
Got it.
You can
Yeah.
really get maximal body contouring, if that makes sense.
Yes.
Sorry if that wasn't
Yes.
clear.
Totally. I think the channels that I'm following, they've lost like 200 plus pounds. I think that's why these different incisions are needed. What are your top, like, if someone's going into surgery, do you have any things where you're like, hey, I really recommend you do XYZ, whether it be like nutrition or any other type of things leading up to surgery?
Yeah, so we cover that with being weight stable, I think is very important, but also, yes, nutritional optimization is important, and then also avoiding bad habits like smoking, because it really does increase complication risk. Yeah.
Definitely. And
Mhm.
then when people get surgery afterward, and I know this, gosh, probably this is going to vary based on what procedure. Let's just say they have a simple tummy tuck. How long are they out of work or kind of out of commission?
Out of work, usually I recommend 1 to 2 weeks out, just taking time off of work, depending on the procedure and what they do. It's definitely the recovery is definitely the worst, as you can imagine, in the first 1 to 2 weeks. It does get better
Yeah.
after that, gradual improvement. But the first 1 to 2 weeks is the most intense. It's not a bad idea to have some help at home and, yeah, take off those 2 weeks from work. And then you can see some gradual improvement from there. But exercise, things like that's a little longer term. You can get back to most of your normal activities by 4 to 6 weeks, with exercise being at 6 weeks. Yeah.
Awesome. Is there anything afterward that you recommend they do so that they get the best results? I don't know. Is there anything is there any validity to anything that you can do that actually helps with scars not being as bad or anything like that?
Oh, great question. There's not a ton of great evidence on certain scar creams, but there is good evidence on silicone-based treatments. So we recommend silicone sheets, just these silicone strips that you can apply to your incisions, usually about 2 to 3 weeks after the surgery when you're fully healed and there are no scabs.
Mhm.
That those silicone sheets put pressure on your incisions and they keep them hydrated. Healing incisions like hydration, and that prevents this overproduction of collagen, which creates the angry looking scars. And there's also some evidence that it downregulates fibroblast activity, all sorts of collagen related things, but it reduces tension on the scars. That's what we usually recommend. But you have to stick with it for about most of the day for 2 to 3 months. Yeah.
Wow. Yeah.
A lot of scars, but they do well. We put them discreetly, yeah,
Yeah.
strategically.
I feel like a lot of people, at least a lot of people listen to my podcast, they're not necessarily right in a city where they have access to a great surgeon. Many of them will travel. What is realistic with travel? Do people stay by the surgery center afterward? How does that work for someone that's not living really close to that place?
Yeah, that's okay if you travel. Sometimes people do travel several hours or longer just to find a surgeon that's doing their procedure
Mhm.
that they're interested in. I would say it is a lot more planning. Definitely have some help with the transportation. I would plan to stick around town for at least a couple days to a week after the procedure, depending on what it is. And then you do have to work out with your surgeon, ranging for follow-up appointments,
Hmm. Hmm.
that nature. Me personally, I would love to see my patients way more often than not. So it does make me uncomfortable if they get back on a flight right away.
Definitely. Are, are there what kinds of questions are the most common that people ask you when they come in for a consult? What am I missing that everyone asks you?
A lot of people do need clarification on the different types of procedures. People don't know what is available, what you can do for the extra skin, and what the different types are. What we talked about with the tummy tuck standard abdominoplasty versus that circumferential versus the fleur-de-lis.
Got
Those
it.
are all very different options. Yeah.
Yeah,
Mhm.
definitely. And does insurance ever cover it?
So it can cover procedures like a paniculectomy, which is a little bit different from an abdominoplasty. Paniculectomy, you're removing just extra tissue that's functionally impairing. There has to be a medical indication
Yeah.
for those procedures that's well documented before insurance will want to cover it. Unfortunately, like I do think most of these procedures, not just the paniculectomy, like you were saying earlier, improves patient's function. It's not just a cosmetically based, we're not just dealing with appearance. It does improve patient's mobility and comfort and hygiene.
Yeah.
But unfortunately, insurance companies are a little slow with body contouring. So I know they do cover paniculectomy, which
Yeah.
is just removing that extra tissue in your tummy. There's no muscle repair or there's nothing with the belly button that you're doing,
Yeah.
but it does have to have some medically documented reason. Yeah.
Okay.
It's
Sounds good.
rashes. Yeah.
Yeah. Yeah. Let's see what do you think the biggest misconception is when people come in and work with you?
I guess there's two things that are kind of related. Body contouring isn't weight loss. It's not a weight loss procedure. It's really to address extra skin. And to do that, you do have to place incisions. A lot of people will think, oh, can I just handle this with liposuction? And with a skin issue, you need the incisions, unfortunately. But they are placed strategically. They're hidden. For instance, the arm lift incision is in the inseam
Mhm.
of your upper arm. So when your arms are at your sides, you don't see it as much.
Mhm.
And then they do gradually heal and fade over time.
Is liposuction involved with, I would assume that it's partly used with some of these procedures, is it?
Yes, it is. It's a great adjunct for body contouring. For instance, tummy tuck. I always like to do some flank liposuction just to smooth out the trunk contour. So it's a lovely adjunct and by itself, but it's not perfect either. Yeah.
Yeah. This is not a fun part to get into, but I know that there are complications, right? Things that can go wrong. Are there any things that you make sure to highlight for people?
When you're placing those incisions, you can run into wound healing issues. I would say that's pretty common. Most of it is addressed with just extra local wound care, just some
Yeah.
ointment. It's called delayed wound healing. It just takes a little bit extra. You can get fluid collections that's usually managed with drains for certain procedures. And then I would say the last most common complications, maybe infection. It's
Mm.
not very common if you were optimized prior to surgery with all those things that we talked about. You get your nutrition, minimize your risk factors like smoking and excessive alcohol use. Yeah.
Do you think that there's any last words that you would want to leave people with? Maybe any words of encouragement? Because I feel like for me, having almost lost 100 pounds and needing to still lose more and knowing that not to overshare on the podcast. Actually, I've never talked about this on the podcast, but the yeast infections and things, it is so unpleasant, the pain. The point is it's very emotional, but I think that when I see my patients and people get these surgeries, it is so life-changing. So do you have any words of encouragement maybe for them that, yes, it's hard to go through these surgeries, but what do you see on the other side? What do you see afterward that patients, maybe their emotional state being different? Do you experience that in the clinic?
Oh, yes. That's why these procedures are so near and dear to my heart. It's just so empowering when they go through and they get through the recovery. Everything they've worked hard for, all the weight loss, that is the hard part. The extra skin, it's hard to treat that. So once you can get that removed from the surgeries, then they just feel like the whole transformation is
Yeah.
complete. And I see that just being very empowering in terms of restoring confidence and quality of life. And I do want your listeners to know that it's not cosmetic. There is that, what you mentioned with the rashes. They can be there can be significant functional limitations with
Yeah.
hygiene and comfort and mobility. So,
Yeah. Yeah. Thank you for providing that. I really appreciate today. I'm very sensitive to the energy of people that I have on because I feel like people that have had obesity in their lifetime, there's lots of bias and stigma, and we're just very sensitive to the energy, right? And I just feel like it's been really great what's come from you. So just thank you for that because that really means a lot to me. Can you tell everybody a little bit about how can they find you and your clinic? How can they find more how to work with you, things like that?
well, thank you. Let me start off by saying thank you so much. I really do try to create a safe space for my patients and just provide the education where they need it in the judgment-free zone. So I really appreciate you saying that. How you can find me. So my name is Dee Beckman. We're based in Carmel, Indiana. My practice is named My Plastic Surgery Group. And we're pretty accessible. So you can reach us via Instagram, our website, or give us a call. Yeah.
Love it. We'll make sure everyone that's listening, we're going to make sure to link all of this either in the show notes below where you're listening, or you go to rentiaclinic.com and you click on podcast. We have everything linked there. Thanks again for coming on. I know that this is going to give hope to a lot of our listeners. So just thank you so much.
Oh, thank you for having me. Thank you. It's been a pleasure.
That marks the end of today's episode. But if you're newer to the podcast, I want to tell you about something that we have, and it's a free podcast roadmap. So this is perfect for any of you that are listening where you want to be directed to very specific episodes. So let's say that you are just starting out and you want to know, what should I do right when I start on the medications? Or you're experiencing certain side effects on the GLP-1s, or you want to know what to do if you're in a plateau, or if emotional eating is taking over, or if hunger levels are high. So we have many different categories of episodes that we've talked about because there's a lot at this point. So if you want to be able to navigate that very easily, we have it broken down by category and also the episodes that are there, and we hyperlink to everything. So you can just click on it and find the episode, easy peasy. If you want that, you can go to rentiaclinic.com/podcast roadmap. We'll have it linked right here underneath the show notes where you're listening. And you can go ahead and get that free resource so that it makes it easy for you to navigate, because I know that it's really hard when someone has an established podcast. I am such a podcast fiend. I'm listening to podcasts all day long. And when I find one that I love, but there's a lot that are out there, I am so lost. So I hope that you enjoy this free podcast roadmap. Again, the link to get to that is going to be rentiaclinic.com/podcast roadmap. I hope this is helpful, and let me know if you have any questions.